Good afternoon. My name is Soyla Ruiz with the Ruiz team at Keller Williams. We're here today with Fast Care Clinic with Dr. Leroux. Hello, Doctor. How are you today?
Hi, how are you?
Good. Thank you
good.
for having us here today.
Thank you for being here.
Oh, thank you.
Appreciate it.
We would actually like to know how long you've been open.
Well, we've been open for since the beginning of the year.
Oh, okay, perfect. And
Yes.
what kind of services do you provide here?
We offer a wide variety of services, medical services. I like to consider my practice as an integrative medicine or holistic medicine. I'm family medicine board certified, so I do the traditional subjects such as diabetes management, hypertension, lipidemia, cholesterol, so
Okay.
the usual things. But I've also offered the patient alternative treatments such as naturopathic medications,
Okay.
high-grade nutraceuticals. I also do hormonal balance. I did a subspecialty in metabolic and nutritional medicine, which a lot of people really like because it has less of the side effects and they really do work.
Oh, perfect.
We also offer something called PRP, which is platelet-rich plasma.
And what exactly does that involve?
That involves drawing some blood,
Uh-huh.
of your own blood, and centrifuging it or rotating it in a device, and then we extract the portion that is rich in platelets. That's the part that has a lot of growth factors. Growth factors
Oh.
are substances that are needed to repair tissues. So,
Oh, okay.
so we use that portion of the plasma to inject it at the site. For example, if the patient has arthritis of the knees or the shoulders, we're able to inject it there, and that'll help improve their condition. And then sometimes it might even prevent them from going on to surgery. So it's a good option
Oh,
for
that's
the patient.
perfect.
We also have an aesthetic portion to our practice, and we use the same PRP, the platelet-rich plasma, for the face. Some people call it the vampire facelift. Kardashian have used it, and it's a way of injecting those growth factors to the face, and that way rejuvenate the skin.
And how long has that practice been going on?
Well, we've been in this office for since the beginning of the year, like I told you, but we've been here in town since 2006.
Perfect.
So, and it is a method that is used by many orthopedic surgeons, many plastic surgeons in Europe and America.
Okay. And I also noticed that you guys do weight loss as well?
We do weight loss as well. Weight loss is part of the hormonal management as well, because many people cannot lose the weight because their hormones are not balanced.
Right.
And hormones are not balanced for a variety of reasons. Here in America, stress is one of the main reasons. Our
Right.
stress level is high, and the cortisol is the stress hormone.
Okay.
So that's the hormone that could be high or low in our bodies. We can have the so-called adrenal fatigue,
Uh-huh.
where the adrenal glands cannot produce more steroids or cortisol. So we might have to supplement the cortisol, or we might have to lower the cortisol. And so I measure all the hormones in the body, because one hormone affects the other. So it's called a hormonal symphony, or a hormonal web, if you will.
Okay.
So we have to fix one to fix the other.
And have you had a lot of success with that, with patients?
We've had significant success, and it's really feels satisfying as a doctor to see how you change people's lives.
Yeah, definitely.
For example, estrogen has 400 functions in the body. A lot of people think about the sex hormone as being only good for sexual activity, but really and truly it's needed for the entire body. It's needed for memory, for motion, for muscle mass, for bone building. So a lot of people might have the so-called chronic fatigue syndrome,
Right.
and what they really have is a hormonal imbalance, and they might not be able to lose weight, and they might not sleep well. Yes, they might have sexual dysfunction, and we're able to address those issues by balancing out the hormones. And also we offer them, like I said, nutraceuticals, which have the potential advantage over traditional medication, where they don't have so many side effects. As we know, when we give traditional medications or drugs, those aren't substances that are normally found in the body, so you're going to have side effects.
Oh,
So
okay.
you have to weigh the risk and benefits. So this is an option for the patients who doesn't want to take so many medications, and so we
Right.
try to wean them out as much as possible and give them the alternative.
Oh, that's great. And then your age difference, how young or how old do you see patients?
Well, I'm family medicine board certified, so it's, I can see different age range. We usually see the more elderly population because of the, population
That
here.
we're in, yeah.
Yeah, we're in, where Charlotte can do.
And then I noticed it says Fast Clear Clinic. Is that due with time or is that just?
Yeah, I really take my time with patient. That doesn't mean that I see them really quick and then
Right.
send them home. But as you know, when you go to the ER here in urgent care, you're treated like a number. You have to wait long, sometimes hours.
Yeah.
My own wife had to wait several hours just to be seen in the ER where I work. And this is a way of seeing patients quickly.
Right.
And getting into the room and getting an appointment as quick as possible.
And what are your hours and days here?
Our hours is after 3 p.m. Because we see a lot of patients that are working during the day.
Right.
So we try to see them after 3 and after hours.
Okay.
It's by appointments. You just call and make an appointment, and we usually see them the same day or the next day.
Okay, perfect. And then the days?
Monday through Friday.
Perfect.
Monday through Friday. And we also have, like I said, the aesthetic portion.
Yes.
We do Botox. We'll be doing fillers, and in the future we'll be doing fat transfer as well.
Okay.
Yeah.
And how heartful is the Botox?
How helpful?
Yeah.
Oh, it's very helpful. Usually the patients are very satisfied. The Botox are used on wrinkles, mostly wrinkles in motion, like at the forehead and the crow's feet and the frown lines, and that usually patients are very satisfied. Yeah. So aesthetically, it's very pleasing.
And then tell us about your staff.
Our staff, well, we have an RN who works directly with me and gets the patient in and takes the weight and the vital signs and it's part of the history. So that's very helpful. And we have our front desk office, and she's very proficient in what she does, as well as an office manager, Leroux. But I'm very pleased with the integrative portion of this practice because it's an option that some people don't have. We can at times avert the patient from taking a lot of times toxic medications and feeling better. That's what integrative medicine tries to focus on, health instead of disease. So we're trying to get them to optimal health.
And how long is that process? Like for myself, where I've always gone to the doctor and always taken antibiotics, if I want to come here and start getting into that process, how long usually does it take to get all that toxin out of your body?
It's an individualized therapy. It's custom made. It's not like traditional medicine focuses on, you have a disease, you take this medicine, this amount of dose. So each person is going to be different. So it's custom made. And a lot of people also have, like we were talking about causes, they might have toxins in their bodies. A lot of people have a fatty liver, so we might have to detoxify. I worked on my wife, for example. She had a fatty liver and her hormones were out of balance. I detoxified her and she was feeling like when she was 15.
Oh, perfect.
And she's lost weight on top of that.
Oh, that's fantastic.
And actually there she is.
And so
I'm glad that people actually feel better and their lab work shows that they're doing better as well. So it's an individual therapy based on what's the underlying condition. Sometimes we might have to detox because we're surrounded by a lot of toxins in our environments. For example, the plastic bottles have what we call xenoestrogens. Xenoestrogens are chemicals that act like estrogens, but they don't function the same way, so they could cause a lot of harm in the body, especially to a female.
Okay, and then do you know if, I'm not sure if you're aware or not, the insurances, like what insurances do you take, or do you know insurances
We take
that
most
that?
major insurances. We try to work with the patient as much as possible as we can with their insurance.
Right.
At times there might be certain tests that we might have to order it, specialized testing for hormones, especially like the metabolism of the hormones.
Right.
We want to know how your body's handling the hormones and if you're at risk for certain cancers, for example. If your metabolism is not good, then you might be higher risk for certain cancers, like the breast cancers, ovarian cancers, and then you can do something to help your body metabolize and detoxify yourself to prevent that risk.
Okay, perfect. Well,
So,
I appreciate your time, Dr. Leroux.
thank you for being here.
You're very welcome. You guys heard it. He's here Monday through Friday by appointment. Please give him a call.